Hello everyone. Today in our mental health class, we are going to talk about anorexia nervosa, commonly known as anorexia. And this is presented by Madusha, Abyan, Janine, and Michelle. So let's begin. Our agenda in this presentation will include a discussion about anorexia nervosa as an eating disorder, a Canadian statistics of anorexia nervosa, the epidemiology and demographics, signs and symptoms, and the usual age of diagnosis for anorexia, and factors that impact the condition or diagnosis, basically the social determinants of health that increase the risk of poor health outcomes or disparities for anorexia nervosa. Next, we're going to talk about nursing care and evidence-informed practice, wherein we will identify and discuss the diagnostic criteria for anorexia nervosa, pharmacological treatments, and also the non-pharmacological treatments. Finally, we're going to talk about nursing assessments and the associated interventions for anorexia. On our last few slides, we're going to talk about the summary, some implications, and conclusion about our topic of anorexia. Here we will discuss about community resources for reference on anorexia nervosa as an eating disorder and the importance of knowing about anorexia nervosa in our nursing practice. There are three main types of eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorder. And in today's presentation, we are going to focus solely on anorexia nervosa. According to the DSM-5 diagnostic criteria for anorexia, a patient can be diagnosed with this eating disorder when criteria number 1, there is a restriction of energy intake relative to body weight. Criteria number 2, there is an intense fear of gaining weight or being fat or persistent behavior that interferes with weight gain. Criteria number 3, there is a disturbance in the way the patient experiences their own weight or shape, or there is an excessive influence of weight or shape in their self-evaluation. There is also a lack of recognition of the seriousness of their current low weight. Anorexia nervosa can be categorized into either restricting caloric intake or binging and purging. Purging can refer to vomiting or using diuretics or laxatives to prevent weight gain. Anorexia can affect nearly every body system in profound ways. It is one of the most lethal psychiatric disorders, and this is a debilitating disorder that manifests in physical, behavioral, and psychological symptoms. In 2012, according to Statistics Canada, anorexia nervosa is prevalent among young females, that is 0.4% and 0% for males respectively. And it is defined as a mental disorder occurring predominantly in females with 90% of cases or more. It affects between 0.3% and 1% of women. The onset is typically in mid to late adolescence, with behavior likely beginning as innocent dieting. Gradually, weight loss becomes an obsession and progresses to extreme and unhealthy weight loss. Suicide attempts occur in about 20 to 30% of the patients.
The epidemiology and demographics of anorexia include 90% of the affected are women between ages 12 to 25 years of age. 10% of the affected are male. Anorexia initially was found in middle to upper class families, recently has now been found to affect all different social statuses. The percentage of the population diagnosed with anorexia nervosa is 33.8%. 85% of patients have been found to be between ages 13 to 18. Typically affects those with altered brain function, which include deficits of dopamine and serotonin. The mortality rate of those affected with anorexia nervosa is between 10 to 20%. The signs and symptoms and usual age of diagnosis of anorexia include restricted eating, extreme thinness, which is also called emaciation, intense fear of gaining weight, distorted body image, mild anemia, constipation, low blood pressure, lethargy or fatigue, slowed breathing and pulse, and the usual age is between 12 to 25. Risk factors of disease include biological relative with anorexia, if they have a history of dieting, a history of body image dissatisfaction, a stigma around their weight, bullying, or any historical trauma.
In addition, for the risk factors continued, please click on the play button to listen and hear more about anorexia nervosa in the field of behavioral sciences by Osmosis. It's his YouTube channel. And underneath the video, there is a chart that displays a number points from 1 to 3 to classify a patient with manifestations of anorexia nervosa. And this is taken from the International Statistical Classification of Diseases and Related Health Problems, 10th revision. And it is a World Health Organization version. So there, in this chart, there is a core attributes and supplementary attributes. And in the core attributes, displayed are pain or discomfort, physical functioning, emotional state, fatigue, memory and thinking, and social relationships. And when the person is doing an assessment with a nurse, and the nurse puts the 3 points and 2 points respectively, then the patient may be classified as having an eating disorder, specifically anorexia nervosa. In the Canadian health system, feeding and eating disorders are diagnosed by medical professionals, specifically physicians and nurse practitioners or psychologists. So nurses cannot make a diagnosis to call a patient with having anorexia nervosa. But it is important to know about these diagnoses so the nurse is able to distinguish and observe a patient displaying these attributes. And these diagnoses are guided by the Diagnostic and Statistical Manual of Mental Health Disorders, known as the DSM-5, published by the American Psychiatric Association. And this manual is revised periodically with input from professionals in Canada and the United States. So the criteria for diagnosing a patient with anorexia nervosa is that there may be a deficient volume and imbalanced nutrition. There is less than body requirements in relation to a loss of appetite, inability to drink, nausea, vomiting, laxative abuse, and there's an activity intolerance in relation to fatigue and weakness, disturbed body image in relation to a misconception of one's actual body appearance, constipation in relation to lack of adequate food, fiber, and fluid intake. There's a defensive coping in relation to psychological impairment and eating disorder. There's a disabled family coping in relation to highly ambivalent family relationships. Ineffective denial in relation to fear of consequences to therapy and possible weight gain, diarrhea related to laxative abuse, chronic low self-esteem related to repeated unmet expectations, ineffective sexuality pattern related to loss of libido from malnutrition, risk for infection related to risk factors, malnutrition resulting in depressed immune system. There is also a risk for spiritual distress related to risk factors, low self-esteem, uninterrupted family process related to situational crisis. There is an ineffective adolescent eating dynamics related to food refusal. And finally, there is an ineffective family health management related to family conflict, excessive demands on family associated with complexity of condition and treatment. And all these diagnoses are taken from the Nursing Diagnosis Handbook in 2020.
Current treatment approaches for anorexia nervosa may include psychotherapy, medication, or a combination of the two. It is important to start treatment early to reduce the risk of serious complications. Antipsychotics and antidepressants are typically used to stabilize associated issues such as anxiety and depression. Zyprexa and Prozac are some medications that are commonly used to promote weight gain. Enhanced cognitive behavioral therapy helps you identify unhealthy, negative beliefs and behaviors and replace them with healthy, positive ones. It can also help you handle stress and manage your emotions and improve your relationship with others. Some non-pharmacological treatments include ensuring you get an adequate amount of sleep daily, learning how to manage your stress levels, and identifying some strategies to help with problem solving. You can also try to incorporate relaxation techniques such as meditating and breathing exercises. Lastly, having some type of social support system can be helpful. For example, loved ones such as family and friends can help with their recovery process.
Nursing assessments. The nurse has to do a baseline assessment, detailed history from both the individual and with anorexia and the family, physical examination, and for the doctor may order laboratory tests, and the doctor or a mental health expert will inquire about the patient's thoughts, emotions, and eating patterns. And this is a psychological assessment wherein he or she may fill out psychological self-assessment questionnaires. Other procedures can be done, and ordered, such as X-rays to assess bone density, look for fractured bones, or rule out pneumonia or heart problems. Electrocardiograms may be performed to detect cardiac abnormalities. In addition, questionnaires may be used to help assess the patient displaying manifestations of anorexia nervosa, such as the SCOFF questionnaire, screening tools, assessment or diagnostic measures like eating disorder examination questionnaire, tests of body dissatisfaction or body image like body shape questionnaire, tests of emotional and cognitive components, behavioral tests, and risk factors identification, such as the McKnight Risk Factor Survey. There are more questionnaires that are useful and effective in assessing a client to be able to diagnose with anorexia nervosa. Nursing interventions. In nursing interventions, the nurse has to create a therapeutic nurse-client relationship so the patient gets comfortable and the nurse creates trust with the patient. So for biologic, the nurse can assess and monitor somatic symptoms, weigh daily, record all intake, supervised bathroom if purging, establish normal sleep routine, administer medication for depression, and monitor exercise. For psychological, establish trust, use diary for self-monitoring to help identify emotions, correct cognitive distortions, encourage movement like dance therapies so the person can sweat and release endorphins. Assist with realistic goal settings, provide education to clarify misconceptions. For social nursing interventions, be supportive but firm with family, include family with therapies and teaching, suggest resources for information and support, assist teachers with discharge plans and re-entry into classroom. For spiritual, model self-awareness and acceptance, suspend negative judgment, encourage description of eating disorder experiences, encourage expression of life history, and create activities to promote reflection and awareness, and do a peer debriefing of experiences. The patient can access local community resources about anorexia and eating disorders from the Simcoe County Eating Disorder Service, Simcoe Muskoka Health Stats, North Simcoe Muskoka Healthline Canada, Child and Youth Mental Health Resources, Simcoe County Community Directory, Ontario Community Outreach Program for Eating Disorders, National Eating Disorder Information Center, Canadian Mental Health Association, and finally, the Center for Addiction and Mental Health. These resources are not limited. There are more present and updated resources around the internet, and information about mental illnesses is more discussed at these times.
That concludes the presentation. However, I'd like to quickly summarize the main points. Patients with anorexia condition have painful and unreasonable fear of gaining weight and developing body fat. They may assume they are overweight even if they are underweight for their height and age. Anorexia is the most severe eating disorder. Some persons die from the lack of food problems while others commit suicide. The condition anorexia can be diagnosed in a variety of ways and managed with a variety of treatment options. The goal of the nurses is to identify patients' adapting level, ability to deal, behaviors, and situations that promote weight loss, but also providing changes to improve. Patients have anorexia experience low levels of hope in their life. and it is the nurse's duty to work with the patients who are discouraged regarding their health. Nurses are needed to provide care that gives patients with eating disorders hope and improves their sense of closeness. Nurses have to review alternate coping techniques for dealing with painful feelings and assisting in the development of daily and weekly goals by using various techniques. They have the responsibility to help patients with various types of interventions, such as regularly assessing, promoting social support, and focus on providing disease treatment and support resource education to clients and their families. Here are some community resources for anorexia. These resources will help you find some great information regarding anorexia condition, such as what is anorexia, the treatment, education, signs and symptoms, and other useful instructions. I sincerely appreciate that we have had this opportunity to present to you. And finally, let's finish with this powerful quote: "Never lose hope, storms make people stronger and never last forever." Thank you so much.
And that concludes our presentation. Thank you very much, everyone, for listening and watching our PowerPoint slides and videos. We hope you learned something from our PowerPoint presentation and that we are all more aware of anorexia and eating disorders, and that we know where to find resources, local resources in the Simcoe Muskoka County. And once again, in the Canadian health system, feeding and eating disorders are diagnosed by medical professionals such as physicians and nurse practitioners or psychologists, and not RPNs or RNs. So these medical professionals are guided by the Diagnostic and Statistical Manual of Mental Health Disorders, published by the American Psychiatric Association. And anorexia is once again a psychiatric or mental health condition that can be life-threatening and accompany behavioral and psychological disturbances. Pharmacological treatments are not really evidenced as effective, and non-pharmacological treatments are best, like CBT and family therapy, and interdisciplinary treatment of the client with anorexia nervosa is better to be initiated, such as nutritional rehabilitation, resolving conflicts around body image disturbance, increasing effective coping strategies, addressing the underlying conflicts related to maturity fears and role conflict, and assisting the family with healthy functioning and communication. Thank you again, everyone, and have a great day. Good luck for the final exams.